Welcome back. Today we'll be covering the cranial cavity. So first let's talk about the dura. The dura is a fibrinous membrane that both infiltrates and covers the brain, and its main role is protection. So the dura is made out of packed fascicles of collagen fibers arranged in lamina, which are the layers. And there are several processes, but these are the main ones you should know. The falx cerebelli, which will partition the brain in the right and left hemisphere. The tentorium cerebelli, back here, that will partition the occipital lobe from the cerebellum. The falx cerebelli, back here, it will separate the cerebellum from the occipital bone, and the diaphragma cellae. These are the sinuses. Anteriorly, we have the sphenos parietal and then the cavernous sinus. Remember from a couple lectures ago, we talked about any infection from the danger triangle of the face could infiltrate the cavernous sinus, along with any, rupture of the membrane in the nasal pharynx. That could also infiltrate into the cavernous sinus. And you see the anatomy here. It's very, very close to the center of the brain. It's very close to the brainstem. That's why any kind of infection that travels in is very dangerous. Midline, we have the superior sagittal, and then the inferior sagittal, and then it goes into, we have the superior sagittal up here, the inferior sagittal here, and then it goes into the straight sinus. Laterally, we have the superior petrosal. As you can see, it runs right along the petrosal bone. The transverse, the inferior petrosal sinus, and then that all goes into the sigmoid sinus. And then the traumas that damages sinuses could also cause a blood clot and lead to a hemorrhagic infarction, which is a stroke. So the dura is made out of these two layers, the endosteal, the upper, and the meningeal, the lower, the deeper layers. The sensory nerve endings are restricted to the, the space between these layers, and the cerebral blood vessels follow those nerves. So those are not found in the brain itself, or the arachnoid or the pia mater. So the leptomeninges are the arachnoid and the pia mater. These are much more delicate compared to the dura, and those are separated by the subarachnoid space, which is filled with CSF fluid, and the layers, the membranes, are joined by trabecula, which will support and give the layers structure. So the subarachnoid cisternae, there is the magna cisterna, which is also known as the cisterna cerebellomedullaris back here, the interpeduncularis, and then the cerebellopontine. These are the main cisterna. We don't have to go too much into detail because there are many arachnoid cisterna. And within these cisterna are the arachnoid villi, or the Paconian bodies, and as you can know, it exchanges nutrients and materials through the CSF fluid to give the brain materials and energy. So the ventricles. Ventricles are important because inside of it are the choroids, and that is where the CSF is produced. We have the lateral ventricles right here, and then that is where the choroids are, and that's where CSF is produced. So from the lateral ventricle, it will go into the third ventricle, which is here, and then it will go down the aqueduct of Sylvius into the fourth ventricle here. And then from the fourth ventricle, it can go through the foramina luschka and Magendie into the subarachnoid space around the brain, as you can see here, or it can go down right into the spinal cord. And the CSF is absorbed over the entire surface of the brain, not just within these aqueducts. So brainstem. The brainstem is made out of the medulla oblongata, the pons, and the midbrain. and it occupies the posterior cranial fossa, and it's a conduit of ascending and descending tracts of nerves, and is the reflex center of respiration, cardiovascular, and consciousness. And from there, cranial nerves 3 through 12 emerge. So the medulla is involved in sneezing, vomiting, heart rate, breathing, and blood pressure. It's found at the foramen magnum and C1 process, and it extends into, so it goes up into the fourth ventricle and down into the spinal cord. And it's separated by the occipital bone by various ligaments and meninges. So you can see here, this is a cadaver's medulla. So first, let's go into the ventral medulla. There is something called the anterior median fissure, and that will conduct the basilar nerve, artery. And then there are the pyramids, which contain the cortical spinal tract. And then at the pyramidal desiccation border, that will be the right here. That would be the border between the medulla, the end of the medulla and the actual beginning of the spinal cord right here. And then the pre-ovulatory sulcus, which is let's find this really fast. So right before here, right here, and that will be where the hypoglossal nerve will emerge, cranial nerve 12, and then the olive itself will have the inferior olivary nuclear complexes, and then post-olivary are the rootlets of cranial nerves 9, 10, and 11. As you can see here, post back here, and then the anterior external arcuate will divide right here. It will go in between olives and separate the medulla. And this is like a deeper version because of this picture, because the pyramids would be covering these up. And you can see here's the olives, and here are the rootlets. So the dorsal medulla, there's two parts. There's the closed part that contains the posterior median sulcus, the gracile tubercle, or also known as the clava, the posterior intermediate sulcus. Here we go. And the cuneate tubercle, right here. This is the greater tubercle. The open part is called the restiform body, and those contain fibers that make up the cerebellar peduncles, and those are crossed by stria medullaris, which makes up part of cranial nerve 8. So you might be asking, why are we going in so much detail about these, and how come we're not going in so much details? Because this is a fairly surface level knowledge. Well, it's because if anybody wants to become a neurosurgeon, all of these are fairly obvious landmarks. So if you know that there might be a lesion within this within the medulla, we can use these clinical surface anatomy to kind of track where incisions might be and what nerves might be damaged. Okay, so anterior pons is usually covered by the cerebellum, and there is one big sulcus called the transverse sulcus, and the cerebellopontine angle will be conducting the cranial nerve 7, 8, 9 roots, and the pontine cistern will separate the pons from the clivus of the skull. Remember, that's in the very back of the occipital lobe, right at the posterior foramen magnum. This one is the one that has a basilar groove for the basilar arteries, and there is the cerebellar peduncles, and from there, cranial nerve 4, as you can see, the trochlear will wrap around Like, that's kind of important. It wraps around, and right below it is the superior medullary velum. So the posterior pons forms the floor of the fourth ventricle. Remember, the fourth ventricle is like down here. It will be limited by the superior cerebellar peduncles and the sulcus limitans. There's the median sulcus in it and the median eminence. And the inferior end makes the facial colliculus, which is also, a part of cranial nerve 7, the facial nerve. And the locus ceruleus has the substantia pharyngia, which contain the amount of norepinephrine or noradrenaline in the forebrain. So this is kind of like the path where those neurotransmitters take. And the vestibular area is limited to the sulcus limitans, or lateral to the sulcus limitans. So the midbrain has the transverse tentorial notch, and it connects the pons and the cerebellum with the diencephalon. Laterally are the parahippocampal gyri, right, as you can see here. The tectum has the pretectal area, and the corporal quadrigemina, there we go, which are these four, bulbs. And the bases pedunculi have the substantia nigra and the crus cerebelli. Here are the substantia nigra. Here's the tectum up here. And then here's the periaqueductal gray. So the tegmentum is between the midbrain and the substantia nigra. So it's more like this way. It's more ventral. And the cerebral aqueduct is in the very center, the periaqueductal gray. Ventrally, the crura cerebelli come from the cerebral hemisphere, and then they enter the pons, and they converge to form the caudolateral boundaries of the interpeduncular fossa. And the basilar artery will divide into the right and left, posterior cerebellar artery at the tentorial notch. And then cranial nerve number 3 has the roots in this area. So as you can see, this is the path of the ocular motor nerve. And posteriorly, a cerebral artery will pierce the posterior perforated substance. And then there's the optic tract at the crus. Dorsally, the superior and inferior colliculi are separated by the cruciform sulcus. The cruciform sulcus is in between here. It's in the shape of a cross. Up here, the superior versions will be involved in vision, and the inferior is an auditory. The superior quadrigeminal branches will have the fibers that come from the retina to the superior colliculi. So the retina comes, and then the fibers go into here. And then in the interior, it should be inferior quadrigemina. The fibers will come from the lateral lemniscus and the inferior colliculus to the mediogeniculate body. And that's where it will process auditory information. And just as reference, up here is the pineal gland, and up here would be the pulvinar of the thalamus. And then the median frenulum villi is where the trochlear nerve will emerge. So the diencephalon is made out of the epithalamus, the dorsal thalamus, and the ventral hypothalamus. The thalami are on either side of the third ventricle, and it plays a role in the afferent sensory, and it conducts those fibers to the cerebral cortex. The information it conveys as pain and temperature. So on the floor of the third ventricle is the optic chiasm, the tuber cinereum infundibulum, the mammillary bodies, and the posterior perforated substance. Lots of stuff. And the pituitary is attached by the infundibulum, and it lies in the sella turcica, remember the skull. And anteriorly, it has the hypophysis, and it's subdivided into the pars tuberalis, it climbs the stalk, and the pars intermedia, and then the pars distalis. Posterior is the neural hypophysis. Thank you for your attention. I know this seemed like a very brief overview, and it is. We will be going much deeper in detail when it comes to your neural anatomy and neurological course. All right, thank you for your attention, and good luck studying.